So my name is Justine Levesque, and I work at the Canadian Observatory on Homelessness, which is based at York University full-time. And I'm also a member of the Basic Needs Working Group for Age-Friendly Peterborough. And I was a volunteer for Hamilton Aging and Community in 2020 and into 2021. So today I'm going to talk to you mainly about the research that I've done on social isolation involving seniors and their caregivers. So before I start with the research that I've been involved with, I want to give you a little overview of why I do the work that I do. So a lot of people often ask me why I want to work with seniors and why I'm interested in different types of housing. And the reason is because I lived in a form of intergenerational housing when I was in high school. I was living with seniors. I was not living with my parents in high school. I lived with my aunt and uncle, who at the time were in their 60s. And the arrangement was very beneficial to our whole dynamic in a few different ways. So first, they had limited mobility, and they also had a few different health concerns. So I was able to help them with activities of daily living, which includes things like getting groceries, cleaning the house, shoveling snow, cutting the grass, all those different types of things. And because I was able to do that for them because I was living there, they didn't need to pay anyone extra to have those services. And once I could drive, I also helped take them to doctor's appointments, pick up prescriptions, and things like that. And I personally also learned basic life skills from living with them. I learned how to cook, how to do laundry, how to set up and pay, internet and cell phone bills. And then they were also able to learn how to use the internet and how to use cell phones because they hadn't done that previously. And so we were also a source of social interaction for one another. They always had a lot of fun meeting my friends and coming out to volleyball and basketball tournaments. And I also had people that I could talk to if I ever needed anything. And even though I moved out when I went to university, they still call me every week. My cousin is now the one who helps them with things around the house. And on screen here is the house that they live in. And because they live in the country, I would say that they are physically isolated, especially during the pandemic, but they are not socially isolated. So they've lived in the same town for several decades. They have a large social network in this area, lots of family and neighbors that they can talk to. And if they ever needed anything, they could go seek help. And I recognize that this is a very positive experience, and not all seniors, especially those that live in rural areas, are socially connected or have family that live nearby that they can check in on them. Some people, and not just seniors, feel socially isolated because they don't have a lot of connections in their community. And the pandemic has obviously increased these feelings of social isolation and loneliness, particularly among seniors. And so this leads me into the research that I've done that we recently finished with Age-Friendly Peterborough. So this was a 3-part project. It was called Social Isolation to Social Connection. Part 1 was a health and housing navigation study. Part 2, we were seeking to improve communications to support, to access supportive services among seniors. And we also did a participatory action research study. And I'm mainly going to speak to the health and housing navigation study and the research study because those were the components that I was most involved in. And we also had knowledge exchange that was going on through each of these different phases and parts of the project. So in the health and housing navigation study, there were 2 main deliverables or 2 main objectives, and it was to, 1, create a demographic profile of local residents in Peterborough that identified the health and housing needs of older adults now and in 5 and 10 years, and to also identify promising practices used locally and in other communities to meet the needs of seniors that were highlighted in the demographic profile. So key points that came from this demographic profile, we found that the City of Peterborough specifically has 22% of its residents who are age 65 or older. And this percentage is even higher in the rural communities that surround Peterborough. So it's up to 30% in the region of Trent Lakes and up to 28% in Havelock. And so this is the highest proportion of seniors in any major city in all of Ontario, and the second highest proportion of seniors in a city across all of Canada. And this proportion of seniors is projected to increase to 29% by 2040, which means that over 20,000 residents will be aged 80 and over in the city of Peterborough in just under 20 years. Additional key points, we identified that key and major health concerns included chronic health conditions, so arthritis and heart disease. And then, of course, social isolation was a main health concern, given that of the people that live alone in Peterborough, 43% of them were seniors age 65, and living alone is one of the major risk factors for becoming socially isolated and experiencing loneliness. And then, of course, the COVID-19 pandemic created additional barriers to social connection among this population. Now, in terms of housing concerns, the two main ones, as they are in many other communities, were affordability and availability. So you can see to the right here in the table, the average monthly rent and average yearly rent in Peterborough for the different types of apartments, and what kind of income you would need to have for this housing to be considered affordable. So affordable housing typically is meant to cost less than 30% of your income. So if you were trying to afford even just a bachelor apartment, you'd need to be making at least $30,000 for that to be considered affordable. And there's also a lot of senior-specific housing that's lacking in the city. There isn't very many available units in existing seniors units. So in the 5 largest seniors residents in Peterborough, we found that there were only 31 vacancies in the past 5 years, even though there were hundreds of seniors on the wait list. So the wait list to get into housing is quite extensive, into affordable housing is quite extensive in Peterborough. In terms of promising practices, we identified a list of over 30 different types of practices that were being used both in areas close to Peterborough and in other cities and in other countries. And so these practices were organized into 8 different categories. The first being housing-specific practices, and this included things like a home share program, which McMaster has a symbiosis program for seniors and students. Also co-housing developments and transitional housing projects. There was also promising practices that were considered infrastructure. So this included things like heated sidewalks and doing walkability assessments in communities. Third, there were social isolation initiatives. So this included things like pet visitation programs for seniors and for elderly residents. Also establishing systems of social prescribing in different communities, which involves the healthcare system and healthcare providers. And then transportation practices. So in Peterborough, we have something called the Link, and that's buses that serve rural counties, which is often not done. Mainly transportation systems, especially those that are run by the city, are focused on the main urban areas as opposed to rural counties. And then community care has volunteer drivers to assist seniors as well. Now, in terms of the Participatory Action Research Study, we started this in May 2020, and it is still ongoing. The main objective to this was to prevent and address social isolation among seniors and their caregivers during and after the COVID-19 pandemic. So some of the dominant health experiences that we found from our participants, which included seniors and their family caregivers, as well as their formal caregivers. The 3 main ones were altered social relationships, which is not all that surprising, given that many of the activities that seniors and caregivers would be involved in. So that might be recreation programs, arts-based programs, caregiver support groups. All of these things were withdrawn during the pandemic, which contributed to feelings of loneliness due to altered social relationships. Mental strain, which included anxiety, stress, and burnout, were also common among our participants, as well as worry. And so we had one senior who had said, had described their experience with social isolation during the pandemic. And they said, well, I think what it's done to me is you're kind of isolated. You're away from your friends and your family. And, it's a lonely life, really, when you're all by yourself. And then we also collected information on different types of supports that should be introduced or that may exist but are not available to everyone. And the 7 main ones that were described included telephone check-ins, incentives to work in home care, technology support, supports to age at home, caregiver support, funding to support seniors and caregivers, and respectful, clear, two-way communication. And we had one family caregiver explained their challenges during the pandemic. And they said, I'm being pushed into an area that I've never done before. It's like jumping into a new career and without much help. We interviewed this one family caregiver who was a really remarkable individual. So she is visually impaired, and so is her mother. And her mother also has dementia and hearing loss. And they still live in their own home together. And her mom, or the caregiver to her mom, has adapted her home so that her mom can move around the house on her own with some independence. So they've set up like a guiding rope throughout the house because her mom can't see and neither can she. And so it's very difficult to try and keep track of where her mom is if she's, doing cooking or she's cleaning the house and she's not sure where her mom is, because they had an incident where her mom had fallen down the stairs because she couldn't hear her walking around the house. And so they've adapted to try and ensure that her mom can age at home for as long as she possibly can. So one of the major things that came out of this research, is that resilience comes from your life experiences. So some seniors and caregivers had lived through other disease outbreaks. They had lost their spouses and other loved ones, but these hardships give people the ability to adapt to other changes. So even though we were living through a pandemic that really had never been experienced at this magnitude before, or at least for several decades, many of the seniors were able to adapt what they had gone through as children with, say, like polio outbreaks, or seniors and caregivers who'd lost loved ones had already been learning how to adapt to a new way of living before the pandemic, and these experiences contributed to their adaptations during the pandemic, which helped them to maintain their social, physical, and mental well-being. Another key takeaway from this project was that social connections impact your physical and mental health. So sometimes there's a tendency to kind of box physical health on its own, mental health on its own, and social health on its own. But what we heard from all of our participants was that all of these different health domains are interconnected and they impact each other. So while seniors were not able to go out and see their family and have social connections and social interactions, this also impacted their physical health. So they weren't able to leave their maybe it was an apartment building or their house, and their mobility was declining, and so their physical health was declining as well. And then, of course, being isolated also increases, self-reported rates of depression and anxiety, which impact mental health. And the third big takeaway from this research project was that the housing that we live in, is connected to our health. So some family caregivers felt that the housing their parents were living in, like long-term care during the pandemic, was unsafe and would actually harm their health. So they made the decision to bring them into their own homes temporarily. We also heard how seniors whose homes are in rural and Indigenous areas had more difficulty getting home care during the pandemic because they lacked resources in these areas before the pandemic, and then the restrictions due to COVID-19 took away these small amount of resources that are already out there to begin with. And so the type of housing you live in can influence, your mobility, your ability to maintain health on your own, and the ability to access resources to help you maintain health. Accessibility features in homes are also a big impact on whether or not you continue to live in your home. And so a lack of accessible features in like apartment buildings or even in your own home can push seniors further into social isolation. So overall, the right type of housing can have a huge impact on health overall for seniors and for other populations. In March 2021, there was a seminar hosted called A Place to Thrive, Options and Possibilities for Seniors Housing. And this presentation, this webinar was recorded. You can access this on the Hamilton Aging and Community YouTube channel as well. If you have any questions, feel free to email me or reach out to Hamilton Aging and Community. Thank you.